Have you ever wondered why that nagging pain below your kneecap gets worse when you go downstairs or squat down? As a rehab and mobility coach, I've helped hundreds of my clients finally ditch stubborn knee pain using evidence-based methods to reduce tendon pain if performed correctly and consistently. In this video, you'll learn the one reason your knee pain keeps coming back, specifically the patellar tendon, 5 tendon-specific exercises you can do at home with minimal gear, and the simple protocol that gets results even for my busiest clients. Let me start by showing you why everything you've started to learn about patellar tendon pain is wrong and what actually works. So, what's the biggest misconception that's keeping your knees weak and painful? Most people think that knee tendon pain is all about inflammation, so they end up icing it, resting it, and even maybe popping some anti-inflammatories. But here's what the research actually shows. It's not inflammation, but actually tendon degeneration. Think of your tendon like a strong rope made out of millions of tiny fibers. In a healthy knee, those fibers are neatly braided together, but with tendinopathy, some fibers become tangled and weak, like a rope starting to fray. And just like you can't fix a fraying rope by letting it sit still on a shelf, you can't expect to fix a weak tendon by resting it. You need to apply load to it or start gently using it so that those fibers can realign and get stronger. But how do you exercise a painful tendon without making it worse? A 2015 study by Rio et al. Showed that isometric holds reduced patellar tendon pain almost immediately and improved function for up to 45 minutes post-exercise. The key here is progressive tissue adaptation, giving your tendon the exact stimulus it needs to rebuild stronger. But before I show you the exercises, you need to understand exactly what we're targeting. So let me give you a quick anatomy lesson that will make everything else make sense. Your patellar tendon is like a thick, strong rope that connects your kneecap to your shin bone. It's only but it's one of the most important structures in your entire leg. We're targeting 2 key spots with these exercises. The insertion point, where the tendon anchors to your shin bone and where the pain usually shows up. And the body, the main rope-like part that needs to be strong and stretchy. Before we start on our main exercise category, it's important to prime our joints and neurological sensitivity as well to create an environment to get the best results during training. So we're going to start by performing controlled articular rotations, our CARs, so we can prime those joints for our next set of exercises. For today, we're going to be working on the controlled articular rotations for the knees as well as the ankles, starting off with the knees, so you can find yourself seated down on a chair, on the floor, or you can do it even standing up. So to start off, we want to make sure that we are pinning or locking our thigh, your upper leg in position, making sure it doesn't move. And what we're going to do is just observe your tibial rotation around the knee. It should be able to externally rotate as well as internally rotate. And notice that my upper leg is not moving at all. So once you've practiced our tibial rotation around the knee, we're going to incorporate your flexion as well as extension of the knee as we are doing this. So this is how it will look like. So you can start off in a flex position, so bringing your heel as close to the butt as possible. We're going to externally rotate our tibia, and then what we're going to do from here is push forward, extending our knee. And you want to reach a point just shy of locking out the knee. So I don't want you to fully lock out, because once you fully lock out, you can't rotate your tibial. So just shy of locking out, and then we're going to internally rotate the tibial and flex back in, pulling back in. And every time you work on the external and internal rotation of the tibial, I want you to try to continuously squeeze and get more range out of it as you're flexing and extending. So I'm still squeezing as much as I can. I'm squeezing as much as I can internally. And as you're doing this, ensure that you're engaging the right muscles. It should be the hamstrings that are closest to your knees, as well as all around down the lower limb. Some additional key points will be to remember to irradiate or keeping tension throughout the whole body. So keeping it stiff so that we avoid compensation, we can stabilize the body as we're performing the rep, and we can also recruit more muscle fibers to make it intense for the CARs. Every rep that you do, try to squeeze out a little bit more range if possible. You can also explore doing your knee CARs in different hip positions, so you can try doing it in hip flexion as well. So applying the same concepts, externally rotating, extending the knee, internally rotating, flexing this way. So if you're seated on the floor, you can also do it like this. A lot of my clients who first start doing this, they often find that they're overworking on their ankles, so they feel sore on the ankles rather than feeling the muscles around the knee. So what you can do is actually to place your heel on the ground first, and then just start engaging by driving the heel into the ground and backwards. So kind of like doing this way, but onto the ground and holding it there, and just drive the tibial rotation externally and internally, and just find that position. The floor will help you in a form of a feedback mechanism so that you can try to start touching and poking around that hamstring close to the knee and also behind the knee and just trying to find an engagement. And then once you've found an engagement, you can start translating it to lifting off the ground and working on this. And as you practice more and more, it'll start to be easier because this is more of a neurological thing where you have not used it for a long time. So you're essentially teaching your nervous system how to use these muscles for these movements again. So the next one, ankle rotations. We're going to be pushing our foot out this way and just simply do slow and controlled rotations, making sure that you appreciate every angle that you have, right? From dorsiflexion to inversion, plantar flexion, eversion. You can also do it both legs. Make sure when you're performing the ankle cars as well that you're not shifting the hips all around or the knees all around as you're doing this. Because what you want to do is avoid compensation when we're doing the cars, if you remember, and apply the similar techniques of keeping tension throughout the whole body and trying to work to your outer limits. For the first category, we'll be working on isometrics, and this is going to help with our rehab and injury prevention. Alright, so for the first exercise, we're going to be working on Spanish squats. So if you have stretch bands, that'll be ideal. If you have heavy resistant bands, that's fine as well. Something that is hard for you to pull apart. And then we're going to wrap it around an immovable object and then slot our legs through, put them behind our knees, and start from a standing position and slowly lower yourself down. And think about trying to draw your knees backwards and engage those muscle groups that are in charge of helping you to draw your knees backwards and slowly lower yourself down while engaging those specific muscle groups, right, all around your knee. Then from here, engage all the muscles, brace your core, keep your spine neutral, hold there for about 30 to 60 seconds and do this for about 3 to 4 sets with 2 minutes rest interval in between. If you're afraid to go too low for a start, you can start standing up and then slowly work your way lower as you start to progress. So you can start from here, bend a little bit, and then as you get more confident, bend a little bit. As you get more confident, bend a little bit. Just remember to engage all the muscles within your leg, especially the pulling motion towards the back. This specific positioning ensures that the load is directed to the patellar tendon and the quadriceps, rather than shifting the stress to the hips and glutes. Try and feel where the load is being applied to and target the specific tendon you're training. Because at the end of the day, your tendon will improve with the load that is applied to it in a progressive manner. So the next exercise is actually one of my favorites as well, and also some of my clients because it helps provide like a pain relief or analgesic effect. So if you have like a stretch band or a loop band, I prefer stretch bands because it doesn't move, it's stiff. Or if you have a rope, depends on what you have at that point of time. Right? I always have these because these are so good to use. So if you can get one, you should get one. Okay, so without further ado, we're going to be working on this thing called knee extension isometrics. So for the setup, just grab a chair and slot one of the loops around the legs and slot your leg into one of the loops. So it'll look like this. Okay. So to start off, you can work in a position which is midway point between your 90-degree position as well as your 180-degree position. There's no hard and fast rule about this. If you can work on multiple joint angles, then that would be ideal. Okay, so here's how we're going to perform the rep. Ensure that your leg is right in front of the chair leg. Make sure your resting leg is on the floor, planted firmly, helping you to support yourself. You're going to put your hands by your side or on the chair rest, depending on what chair you're using. All right. And when we start performing the rep, we'll start with 10% of effort and slowly ramp up to about 70% of effort. But if you have a lot of pain, maybe stick to around 40 to 50% of effort first. And we're going to hold it there for about 30 seconds to 45 seconds, or even 60 seconds, depending on how you feel today. And do that for about 3 to 4 sets for a start. Isometrics are just the starting point. To fully heal your tendons, you'll need to move on to heavy, slow resistance. And this is what I'll show you next. So once your pain reduces with isometrics, how do you actually rebuild your tendon strength for the long-term health? We don't just stop here, we carry on loading the tendons to build load-bearing capacity. Your tendons need to handle real-world demands like climbing stairs, hills, or working with deceleration. As a progression, you can use loop bands like this, and you can work on EQIs, if you remember EQIs from my previous videos, which is eccentric quasi-isometrics. So what we want to do is find the angle that we want to work in, apply the same techniques like we did on the isometric, so breathing in, holding tension throughout the whole body, supporting yourself, and then hold this isometric with the loop band. All right, so you hold this isometric until you start to feel fatigue, so about 30 or 60 seconds would be a good time gauge before you start failing. And then once you start failing, control the eccentric part of it, which is moving back, all the way back. Okay, and then you start again, push forward, and then we hold again. So if you want more resistance, you can put it further back if you have additional leg on the back side. Okay, and then we can do a EQI there with more resistance. As an added layer of difficulty, while you're performing the EQI and you start to fatigue and you start to work on the eccentric, you can work on the tibial rotation of how we did, just like in the cars. So you can see my tibial is rotating as I start failing. And then I repeat. The next one we'll be doing will be called the step down. You can either use the stairs or if you have yoga blocks, you can use the yoga blocks as well. Something that can help you elevate safely and stand on one leg. If you're using a yoga block, just be mindful of the surface that you're putting the yoga block on and make sure it's not too slippery. And also if you have anything that you can hold on to like a wall, that would be good as well. So to perform the rep, the working leg has to be on the elevated platform. And then we're gonna be working eccentrically, so coming down slowly. So essentially you wanna be working your way down between 4 to 8 seconds. You can also hold on to weights to add more load, or you can elevate the platform to be a bit higher. I use yoga blocks today, but I highly recommend if you can do it on the stairs, it's more stable, or if you have large platforms like a box, that would be safer. Okay, I'm just doing this with what I have today. Now for the final exercise category that bridges the gap between rehabilitation and return to real-world function. If you want to start running again, jumping higher, or simply move with more confidence and less risk of injury, your tendons need to act like loaded springs, storing and releasing energy with each movement. We train this by focusing on the amortization phase, that split-second pause at the bottom of a jump or a hop right before you explode upwards. So imagine compressing a pogo stick. The more you load it, the higher you bounce. So how do we train our tendon springiness? We're going to be incorporating something called ballistics. We can start off with simple movements like lunging and stepping backwards. So it'll look like this. Stepping forward and kicking back up. Then as you get better, you can start to push the knee forward a little bit more and just keep practicing. And then for the next stage, you can jog or run into a step back. So it'll look like this. Please excuse my running today because I only have a small space, so just imagine I'm running. The next exercise you can do will be counter movement jumps. So you can brace yourself, jump up, land. Brace yourself, jump up, land. And when you land, try and land lightly. Don't land flat-footed. Land with the balls of your feet. So just think of yourself as a spring trying to store the energy at the bottom. Release, and then brace yourself as you come back down. For the next exercise, you can do a depth drop. So 1 foot out, and brace yourself for the landing. So for the depth jumps, you can adjust the height according to what's comfortable for you. And if you want to progress further, you can think about landing on one leg instead of 2 legs. You can also wear shoes for a start. I just like doing it barefoot because I've been training barefoot for a while and it feels comfortable for me. Before you dive into the exercises, here's how to set yourself up for success. Step 1, prime your joints. Always start with controlled articular rotations. These are the gentle, full-range movements that help to wake up your joints and get your body ready for action. Step 2, pick your exercise category and stick to it. Follow the suggested sets and reps as a guide, and as you get stronger, progressively turn up the intensity. So for isometrics, you can perform this for about 3 to 7 times per week, doing 2 to 4 sets of 30-second holds with 1 to 2 minutes rest intervals. For the EQIs, you can do this 2 to 3 times per week. And for ballistics, you can also do the same amount of sets and reps. Let's talk about the results, because tendon adaptation will take at least about 2 months for you to see some significant results. It's not an overnight fix. Here's what you can expect. Between weeks 1 to 4, you can expect a reduction in pain. You will also have more control and body awareness, and movements should feel smoother with better functionality. Between weeks 6 to 12, you should start feeling some real strength gains and translating over to your daily activities as well. 3 months onwards, you'll get some tendon adaptation and development of more tissue. As for the maintenance after that, you should try to at least incorporate 2 sessions a week to help your tendons stay strong for the long haul. And some additional tips is to consider tracking your progress every month. Check if your range of motion has improved, how your function of the joints are. Can you move further with less discomfort? and notice if everyday activities feel easier and more controlled. Be patient, stay consistent, and celebrate each small win, because tendon training is a marathon and not a sprint, but the payoff is a body that's ready for anything. Also, if you want more tips and exclusive routines, be sure to sign up for my newsletter using the link below and get evidence-based protocols and advanced techniques sent straight to your inbox. You now know how to bulletproof your knees, but here's the thing, your knees don't work alone. If your hips are tight or weak, they'll force your knees to pick up the slack, and all your hard work rehabbing your patellar tendon could be undone. Think of your hips and knees like gears in a machine. If one jams, the other has to work harder, and the whole system can break down. That's why it's crucial to strengthen both. So don't stop here. Watch this video next, where I'll show you essential tendon exercises for bulletproof hips. Because when your hips and knees move together the way they are designed to, you'll stay pain-free for decades to come.